Subscribe to the channel, like the video and activate the notification bell so you don't miss any news. Let's go. Hello everyone. Have you ever stopped to think if your heart is really okay? Maybe you don't even know it, but it could be crying out for help. Today we're going to talk about the 7 signs in your body that may indicate that your heart is not 100%. And pay attention, because cardiovascular disease is the #1 cause of death in Brazil and worldwide. Around 400,000 Brazilians die each year due to heart problems, according to the Brazilian Society of Cardiology. Stay tuned because this video will be divided into 3 parts. First part, the 7 visible signs in your body that indicate heart problems. Second part, the 7 classic symptoms you feel when your heart is not well. Third part, valuable tips to avoid heart problems in the future. So stay until the end because I'm sure you'll learn a lot of new things. And before we begin, like the video because the more likes you get, the more YouTube distributes this content to people who don't have easy access to doctors or hospitals. Share it with your friends and family. You could save lives with this information. And tell me in the comments. Do you have any heart problems or think you do? What part of Brazil or the world are you from? Let's go. Part 1. 7 visible signs of heart problems. Sign 1, Frank's sign. Have you ever noticed a diagonal crease on someone's ear? This sign, known as Frank's sign, can indicate a blockage in the arteries of the heart. Discovered by Dr. Sander Strijk in the 1970s, this crease is most common in people with angina, the chest pain caused by blockages in the coronary or carotid arteries. Although 30% of people with this sign have nothing, 70% may have some type of blockage. Keep an eye out, especially in younger people, as the risk is higher. Sign 2, hair loss on the legs. Loss of hair on the legs, starting at the shins and then on the thighs, can be a sign of peripheral arterial disease, which is the blockage of the arteries in the legs. Since atherosclerosis is a diffuse disease, if you have obstruction in your legs, you may also have it in other parts of your body, including your coronary arteries. Your skin may become smooth, shiny, and cool, and your nails may grow slowly. Sign 3, xanthelasma. That yellow patch on your upper eyelid, known as xanthelasma, may be an indicator of high cholesterol or high triglycerides. Although it is more common in middle-aged women, half of people with xanthelasma have dyslipidemia. This increases the risk of heart disease, heart attacks, and strokes. If you notice these patches, get blood tests to check your cholesterol levels. Sign 4. Arcus senilis. Arcus senilis is a white or gray ring that appears around the cornea. Common in older people, it does not affect vision, but in younger people it can indicate severe dyslipidemia, increasing the risk of heart disease. In people over 60 it is normal, but in younger people it deserves special attention. Sign 5, cyanosis. Cyanosis is a bluish or purple discoloration of the skin, indicating that the part of the body is not receiving adequate oxygenated blood. It can be a sign of heart or lung problems, such as pneumonia, emphysema, or pulmonary embolism. In more severe cases, it can indicate congenital heart defects. Sign 6. Leg and foot ulcers. Wounds that do not heal can be a sign of poor circulation, indicating obstruction in the arteries that supply the area. Arterial ulcers usually appear on the outer part of the leg, on the heels and toes. Venous ulcers, common in people with varicose veins or venous thrombosis, appear on the inner part of the leg and usually bleed. Sign 7. Swelling in the legs and ankles. Swelling in the legs, ankles, and feet can be caused by a weak or enlarged heart, which accumulates fluid in the body. If you notice that your shoes are tighter or your ankles are swollen at the end of the day, this could be a sign of heart failure. Part 2. The 7 classic symptoms of heart problems. Symptom 1. Shortness of breath or dyspnea. If you feel short of breath when you exert yourself, this could be a sign of heart problems. Be aware of this fatigue that is out of proportion to the activities you are doing. Symptom 2. Persistent cough with white or pink phlegm. This could mean that there is fluid in your lungs or alveoli, a major sign of heart problems. Don't ignore a persistent cough and see a doctor. Symptom 3. Shortness of breath when lying down. If you need several pillows to sleep better or wake up choking during the night, this could be a sign of paroxysmal nocturnal dyspnea, indicating heart problems. Symptom 4. Generalized weakness. Feeling tired all the time and having difficulty with daily activities, such as climbing stairs or combing your hair, could be a sign that your heart is not pumping enough blood to your muscles and tissues. Symptom 5. Nocturia. Waking up several times during the night to urinate may be a sign that the heart is not pumping properly, and excess fluid needs to be eliminated during the night. Symptom 6. Calf pain when walking. Experiencing pain in the calf when walking, which improves when you stop, indicates that blood is not reaching the area properly. This symptom, known as intermittent claudication, may be a sign of circulatory problems. Symptom 7. Chest pain. Chest pain or discomfort that lasts for more than a few minutes and may come and go should be taken seriously. It may feel like pressure, heaviness, squeezing or burning, radiating to the left arm, neck, back, jaw, or stomach. If you experience these symptoms, see a doctor immediately. Part 3. Tips for avoiding heart problems. Exercise. Physical activity is essential for your overall circulation and well-being. Low-impact exercises such as walking, cycling, and swimming can improve blood flow and help your heart health. Quit smoking. Smoking is one of the worst things you can do for your health. It causes inflammation in your arteries, forming fatty plaques that increase your risk of heart attack, stroke, and dementia. Lose weight. If you are overweight or obese, losing weight can lower your blood pressure, improve blood sugar control, and decrease inflammation. This relieves strain on your heart, kidneys, joints, and venous system. Eat healthy foods. Include more fruits, vegetables, fiber, and whole grains in your diet. Cut back on red meat and processed foods. Take care of your cholesterol. If you have a family history of heart problems, get regular checkups to monitor your cholesterol levels. Include foods rich in fiber, such as oats, and avoid trans and saturated fats. Control glucose. If you are diabetic or prediabetic, keep your glucose under control. Reducing the complications of diabetes can help protect your heart. Monitor blood pressure. Keep your blood pressure within recommended levels. If you have signs or symptoms of heart problems, see a doctor and follow their advice. Did you like the video? Don't forget to share it so more people have access to this valuable information. This is the top 10 well-being and health. Remember to subscribe and like the video, which is very important to us. And until the next video, thank you very much for watching this far.